We're just days into the biggest mass inoculation program ever in Canada, and we're hearing there could be a faster timeline. CBC News is being told that every Canadian who wants the vaccine should have it by the end of September. That is months earlier than what federal officials initially offered. The Public Health Agency of Canada tells CBC News it now expects there will be enough doses delivered for that to happen by next fall. Meanwhile, dry runs are taking place to ready the country for the Moderna vaccine once and if it is approved. Major General Dany Fortin is the military commander in charge of Canada's vaccine logistics. Major General Fortin, welcome to the show.
Hey, thank you very much. Thanks for having me.
So we know the dry runs are underway under the assumption that the Moderna shots could be administered before the end of December. Have you uncovered any problems in your test runs so far?
So the Moderna dry run is underway, as you indicated. The plane departed last night from Europe, and it's on its way to being distributed across the country. And in the coming 48 hours, it will be at the different locations that were identified. So far, no indications of any issues, and we've applied some of the lessons that we saw in the last run with a different company. But some of the things steps are very similar, and we had not identified any issues at the time, so it's all very good.
Okay, so the plan right now is that when Health Canada gives its approval for the Moderna vaccine, within 48 hours shipments could begin. Do you know yet how big the first shipment might be? Has that been communicated to you by the company at all?
Yeah, so the company, as was announced earlier this week, the manufacturer would provide an initial shipment of 168,000 doses. And this will be broken down between provinces and territories. The exact allocation is still being refined. So we have points of distribution identified by the provinces, and we're still adjusting as to whether or not we are ready to receive and vaccinate from additional points. So we have a larger list of points, but which ones do the provinces and territories want to turn on with this initial shipment? Because you have to carefully think through the number of doses you have, maintain the second dose, how many people will have access to this. All those things are being worked on, but we're confident we have plenty of points identified that are ready to operate, ready to receive once we receive the Health Canada approval to use this vaccine, candidate vaccine.
Okay, I knew it was 168,000 doses, but I didn't know they were all coming all in the one shipment. So it's going to be one big Moderna shipment as opposed to a series of shipments like we've seen with Pfizer. Is that correct?
It's one order. It's one set of orders, I would say, and it will logically will leave together from the manufacturer and then get to Canada. Will be broken down, repackaged, broken down into smaller packages, and then flown and driven across the country to those different locations. So I look at it this way. It's 168,000 in one shipment over a week or so from putting the order in to receiving it at destinations.
Okay. So, you're in the middle of the dry run now for Moderna, but you've completed the Pfizer shipment to a large degree, at least the first doses of it. Has any of that product gone to waste? I know we've seen some reports from other countries where they've had some problems with the shipping, and there are predictions that in just a normal course of things, 5% or so of a particular medicine could be lost. Have you had any issues whatsoever with the Pfizer shipments?
Yeah, so we have not had any issues, as you indicate, with a percentage of vaccine that goes to waste. What I would say, though, is it's entirely possible that moving forward, a package gets compromised, whether it was damaged in transport, and then we have a temperature excursion. We have not seen any of those problems with this shipment. No temperature excursion. We were able to, at those points of use, quickly prepare and administer those vaccines because they were waiting for it. They were ready.
Okay, so the third. Go ahead.
Yes. Well, I was going to say, so it's entirely possible that as we process, as we vaccinate, and I'm not an expert in that area, but it's entirely possible that there are vials that get dropped, and therefore, because of the nature of this vaccine, will be put on the shelf, and then we'll ask the question to the manufacturer.
Okay, so far, no problems. We are seeing reports from other countries, in the U.S. in particular. They've identified, pharmacists have, that maybe there's some extra doses in these vials and you can get a higher yield than what was initially expected. Do you know if Canada has started to take a look at that, that instead of getting 5 doses out of a vial, you might get 6 or 7?
Yes, as a matter of fact, today we, in coordination with Pfizer and all the provinces, we issued guidance, or relayed the guidance from Pfizer. So the way it works is that there's actually overage in every vial, so that you factor in possible bottom of the vial liquid, and some that gets lost in the syringe, and so on and so forth. So if you're very careful, you could actually have enough for a 6th dose, so a little bit over a 6th dose. There's an indication of 7 doses, but I think we're comfortable with there are 6 doses in each vial, and that's what has been messaged to the provinces and territories earlier today, and they're very much paying attention to that as they prepare and vaccinate.
Okay, that's positive news. So that 30,000 becomes potentially what, like 34,000, 35,000 doses, assuming they're able to extract this safely? Is that what's the new number you're working with here?
Well, so planning figure remains 5. I think we'll give it a few days here to see, what did we observe throughout. But clearly, there's a little bit more liquid than we thought we would have in the end. I don't know if that makes perfect sense here, but as you take liquid out of the vial to administer, it is the actual norm to have a little bit extra, and that little bit extra is enough for a 6th dose. So that's what we're learning.
Okay, so there is a little bit extra in each vial. You've given direction to the provinces that it's okay to try to get that dose, and right now you're operating out of the assumption that at most 5 doses goes to 6, so it's basically a 20% boost potentially, but you want to see how it goes before you give us a revised number. Am I understanding it all correctly?
Correct.
Okay.
Correct.
All right.
If the manufacturer and us had been administering this vaccine for a while, we would have an exact answer to this.
Right.
But we're all realizing this now.
Okay, I want to ask you one more thing about security here, and that CSIS is warning companies in the vaccine supply chain that they could be targeted by hostile foreign actors on this, and that we might see some of in a way that would threaten the vaccination rollout. Are you aware of any specific threats to Canada, or just these general threats that have been warned of?
So I would speak to general threats. We're paying attention to all those general threats. The service, the intelligence service, law enforcement agencies, and various other stakeholders are paying attention to different threats and are crafting the right advice so that it is the appropriate precautions are taken at every level, provinces and territories, and at the federal level. As to specific threats, I'm not going to speak to specific threats, I should say, but rest assured that those are being looked at and the appropriate advice is provided.
Okay, one last question I want to ask you. The Public Health Agency is saying that all Canadians who want to be vaccinated will very likely be able to be vaccinated by September of 2021. Based on how it's going and what you're seeing, do you think that that is a realistic timeline? And does this revelation that maybe there's more Pfizer available in a Pfizer shipment, could that maybe change those timelines at all?
So there's more vaccine available. The vaccine candidates are at different levels of getting their approval, and we expect more vaccines to be approved in the spring and well into 2021. This is our mission, and I'm confident we will deliver. And I am confident that every Canadian will have a vaccine once it's approved, and we'll do this as rapidly as possible and as safely as possible across the country.
Okay, Major General Dany Fortin, thank you so much for your time.
You're welcome. Thank you.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.